unsa pa ba? Uh, fresh kanang mga fruits and vegetables. Avoid too much of salt. No, di na maayo sobrang asgad. No? So, too much salt. So, avoid that. Fatty food and too much salt. No? Sugar, sobra-sobra, especially if nakay predisposition sa diabetes. No? You're not supposed to take lots of sugar. No? So, what else? Ano ba kay question?
Coffee, Dok.
Coffee, ang uban,
milk, Dok eh.
Oo. Ang make sure nga lang, ang imong coffee is not more than 1 cup siguro a day. Kaya tendency nga mo fast-fast, mag-palpitation, no? Sa ako ang 1 cup should be okay, pananglitan. But make sure, kaya naman ka history sa hyperacidity, na kay symptoms sa gastritis. Early symptoms na siya sa peptic ulcer disease, no? So, make sure na when you take coffee, it has to be with food. Your aspirin, kung take an aspirin, it has to be taken with food. Kung grabe na ganyan mong hyperacidity, na yung mga antacids, no, na ang pinakabarato is sodium bicarb, di ba? Pinaka-cheapest na antacid is sodium bicarb to neutralize the acid, no? Or if you can afford na po iban kanang combination sa magnesium aluminum, no, which is you call Malox, no? Either in tablet or in liquid, naapod yung uban ng mas kuhan, mga preparation sa Tagamet, Zantac, no? Sa mga grabe na yun na hyperacidity. Pero for kanima, early pa lang ang symptoms you have to make sure that you eat on time. And when you have to eat on time, no? And then naapod kay kanang in between nga snacks, especially with milk, pananglitan and crackers, no? In between pa sa imong regular meals. And when you take medicine, especially aspirin, it has to be with food, no?
Pwede sabay yun, Dok?
Pwede sabay yun sa kaon.
Hindi ka nang turo ba? Usay ka nang
Oo, kanang calcium block nimo or D block nimo, pwede na siya nga magdungan sa aspirin.
Ginadungan ako, basim.
Dili. Kanang mga once a day nga dosage, pwede sa buntag na tanan, no? Pero make sure na puno imong tiyan, kung nakakay ikaw. Ayaw yun pag-take, especially aspirin, without food in your stomach. Kaya magkuhan, masamot na imong hyperacidity. No? So later on, i-check natin imong kuhan, imong ECG ka na mo.
Sky Cable Channel 28, The Beautiful Heart Show. We will continue the management of a patient with hypertension. We know that one of the complications of hypertension would be to affect the heart. No? Some patients with chronic hypertension develop cardiomegaly, or their heart tend to enlarge, especially the left side of the heart. And at the same time, because of the atherosclerosis, some of these patients also develop ischemic heart disease. So part of the workup, or as part of a management plan for patients with hypertension, is to do an electrocardiogram, or what we call EKG or ECG electrocardiogram. We have a machine here, a portable electronic electrocardiogram, and basically you check the electrical impulses coming from the heart, and it is recorded in a piece of paper, and then you interpret that. We call this as 12-lead EKG, and the electrodes would be attached to the chest. No? There are about 12 electrodes, and you need kind of a conduction material here. So our patient should feel relaxed, no? Before you start the EKG. Make sure that there are no metals attached to the body, and of course you have to maintain a sense of privacy. You cover the patient with kind of a gown, and then you tell the patient to relax. No? It is a kind of a resting EKG. We called it resting dahil ang pasyente nakahiga, no? There is also that what we call a stress treadmill EKG, where the patient is attached to the EKG machine while they are doing treadmill exercise. It's a different way of getting ECG. This is what you call a resting EKG. So there are 12 electrodes. There are chest leads and limb leads. So first you attach this conducting material. So the first one, the lead, the V1 or your chest lead should be the second intercostal space. No, 1, 2. So you attach that to your right, and then the second lead would be on the second intercostal space on the left side at the level of the second intercostal space, and the third would be on the third, and the fourth is just like on the fifth midclavicular line. Fifth lead. 1, 2, 3, 4, 5. 1, 2, 3, yeah, 5 and 6. On the side. This is a 12-lead EKG, and you have 6 chest leads and 4 leads on the limbs. So you put one in here, you also put another one there, and in the lower limbs you put the extra electrode there. So all in all, you have a total of 12 electrodes. Now you connect the electrodes. You notice this is color coded, and it will also tell you, right arm, left arm. So you put you can start with the limbs first. The 4 limb leads. Okay, locate that. So right arm, RA. No, the other side there. And the other one is right leg. And then left leg. Oh, this is left arm. So left leg. And then the V1, the chest leads, you gather them all together, kata. No, you locate for the V1. And then the V2 there, V3. Make sure that the leads are not entangled, otherwise you will have the port raising later. Then V4 and then V5, V6 to the right. Everything, check all the leads, if it's all connected. On, and then auto print. Printing the we will make 2 copies for the patient. Okay. So this is the typical tracing of a 12-lead resting EKG. You notice you have lead 1, 2, 3, AVR, AVL, AVF, V1, V2, V3, V4, 5, V6. In the EKG, you need information, of course, from the patient. So it's almost that, yeah. Them out. You put it back here. The